WDSU medical editor Dr. Hebert joining us now with more on the nursing home deaths and just the heat that people are dealing with here, Dr. Hebert.
Yes, I mean, we, in general, let's just say we don't have all the information right now, but in general, we don't put people in wards anymore. So in one nursing home facility, that is a facility that has different spaces for different types of situations and different people. So when you put all of those folks in a warehouse, it is basically a makeshift ward, which means that you are having communicable diseases possibly going back and forth, as well as the heat. I mean, we don't know the actual circumstances of all of this, but we do know is that if you don't have the adequate amount of air conditioning and ventilation for an area like that with those types of fragile patients, we know that they're fragile and because they're in a nursing home, which means by definition they cannot stay in their own home and take care of themselves because they wouldn't be in this facility. So that means that they are medically fragile, and it also means they're at increased risk for any communicable disease. Now, obviously, Ida is causing a lot of problems, but right before Ida, we had COVID-19, which has not gone anywhere, which means this group is more at risk for getting COVID-19 and more at risk for any type of illness. So this is a real problem right now.
Let me ask you this. 3 of the 4 deaths have been classified as storm-related by the coroner in Tangipahoa Parish, but the definitive causes of death not yet determined. We don't want to jump the gun, but could that be heat? Could it be something that happened 4 days ago when the storm hit? I know we're going to get more on this from the coroner, but what could storm-related actually mean?
More than anything, it could be if they were evacuated before the storm, it could have been that they were dehydrated or had heat-related illness on the way to the facility. It also could mean that at that warehouse, a window could have broken or some type of debris could have hit the person, and then they could have actually perished that way. But more than likely, if you are a person who's over the age of 65, 70 years old, and you are being transported because you're a medically fragile patient, more than likely it was heat exhaustion, or they could have had heart attack or stroke. Because just because they're being transported doesn't mean that they still don't have the same risk that they would have had they been in their nursing home facility. When you are being transported that way, you have an increased level of anxiety, an increased blood pressure, increased heart rate because you're nervous, scared, you don't know what's going to happen, and that can exacerbate any illness.
Sure, all of that makes sense. And Dr. Hebert, we have been talking, over and over again about our vulnerable population. We've been so concerned about them since this widespread power outage and this heat. What is your advice for people who are a little more on the risk side, the vulnerable population we've been talking about?
Yeah, we said this always before people are going on evacuations for hurricanes. Please make sure you have all of your medicine before you leave, just because you never know how long you will be gone. So you need to make sure that you take your medicine every day. You need to stay out of the heat as much as you can, and you need to hydrate. Please drink water. Do not drink a lot of alcohol. Do not take any drugs at this point, because dehydration will set in and you won't even know. You won't even feel it, because what will happen is that you'll get a little dazed. You'll feel a little incoherent in your speech, and people will see that around you. But at that point, it may be too late, because you can't just rush to the hospital because you may not have gas. You may not have the ability to get there. So that's why you have to take these precautions. And that's why we always say when you are about to be evacuated, we want you to have 6 weeks of medicine, because right now we may not have power for a very long time. And that means you don't have pharmacies, so you can't get your medicine.
Really quickly before we let you go, first off, we want to show that graphic again. The people there were taken from 7 nursing homes. We're going to show that graphic again. These 7 are the homes, the facilities that evacuated residents to that facility in Independence. At this point, no names being released of any of the 4 people that died. Once again, 3 of them are considered storm-related. Final question here, Dr. Hebert. Did we learn anything from 16 years ago? We all know what happened when it came to senior care and senior facilities after Hurricane Katrina at Baptist Hospital, at places like St. Rita and St. Bernard Parish. But what have we learned? Because you hate to see anything like this. It's heartbreaking to see that these people survived such a horrific hurricane, and now tragically they have died days later.
You know, I feel like because our hospitals are doing so well with the service and the ability for them to take care of their patients uninterrupted, we learned a lot to be able to take care of the patients that we're taking care of now without having any power. But obviously, some people did not learn anything, because you cannot put 800 people in any place at any time after a hurricane, because it's by definition a super spreader event, let alone some place that is going to be and people are going to have so much stress that they're going to increase all of their pre-existing conditions, and that is heart attack and stroke, which are the #1 causes of death of anyone in America.